Namaskaram to all. Today we are here to discuss a very relevant topic of today's diabetic neuropathy. As we all know, India becoming the capital of diabetic patients all over the world. And when we have moved away from our regular physically motivated agricultural pattern of living to a more sedentary habit in our day-to-day life, the fact remains that more and more of our population is becoming prone to the so-called type 2 diabetes. And the fact remains that as we have a larger population of diabetic patients coming into our society, living their lives, the possibilities of having the diabetic complications to the same population have also increased to a great extent when compared to the previous decades. That is our clinical observation. And the three important complications that are usually seen in the diabetic spectrum, the diabetic neuropathy, nephropathy, retinopathy. Among that, neuropathy is the very common thing that affects almost 25% of the patients who are already diagnosed with diabetes. So when coming to the possibility of Ayurveda with respect to the management of diabetic neuropathy, a few things regarding how Ayurveda looks at diabetes. Now, all the classics of Ayurvedic texts, right from Charaka Samhita, Sushruta Samhita, Ashtanga Sangraham, etc. All of them actually define the so-called spectrum of diabetes disorders under the large spectrum of condition called as Prameham. And Prameham basically is divided into two types, Sahaja Prameham and Apathya Nimittaja Prameham. Sahaja Prameham, which actually is because of a Bija Dosham, that is congenital issue, and of course can be related with the type 1 diabetes, and Apathya Nimittaja Prameham, which is actually with the background of following of something which is not conducive of lifestyle, etc., that bring in something similar to type 2 diabetes. And when this type 2 diabetes is afflicting an individual, blood sugar getting not controlled even with medications, lifestyle, etc., over a period of time it gets affected the nerves, specifically the peripheral nerves, and the patient's presents with basically burning sensation of both upper limbs, especially the palm, and the feet, which is something called as glove and stocking sensation, and the patient's presents with the tingling, burning, the numbness, difficulty to wear chappals. Many a times elderly patients communicate that then when they walk, their slipper slips away, they don't even realize. Difficulty in walking, difficulty in having balance while walking, and over a period it becomes very difficult for them to walk itself, because as the nerve damage continues to aggravate. At this point, the role of Ayurveda is definitely at two levels. One is at the preventive aspect and the second one is curative aspect. Now when it comes to preventive aspect of diabetic neuropathy, patients who are already diagnosed with type 2 diabetes, who are on allopathic medication, metformin, etc., the role of Ayurveda is to definitely have been a supportive system wherein further progression of the issues into diabetic complication to a great extent can be prevented. And the second aspect is, once the diabetic neuropathy is set in, there are many specialized treatment modalities that actually would help the patient to recover the whole symptoms of diabetic neuropathy. So there are some special treatments, something called as Vasti, therapeutic enema, wherein some special medications are made into a particular combination of emulsion and given as enema per rectum, and detoxification of the body happens, which actually helps the body to recover the damaged tissues over a period. And of course, other treatment modalities like Kshiradhara, wherein some special medicated milk is prepared and poured all over the body, especially with some specific medications like Guduchi, Kokilaksha, Bala, etc. And some specific treatment modalities called Takradhara, wherein medicated buttermilk is poured over the head. And the treatments that are done over the head according to Ayurveda Urdhva Moola Adha Shaka. For the body, it is actually the Urdhva, the upper part is the Moola, the root of a plant, and the whole other part is actually the branches. And controlling the root is ultimately bringing the responses in all over the body. And hence, in this management, it is very important to have various therapies over the head, like Takradhara, Tailadhara, etc., which will bring in responses in other parts of the body too, which is mostly utilized in the management of diabetic complications. So in all ways, in many methodologies, we are able to a great extent give solace to the issues faced by the people who are suffering from diabetic neuropathy. And one more modality, therapeutic modality of management is of course something called as Pada Abhyangam, that is foot massage with some specialized oil. Oils like Balam, Guduchi Adi, oils like Pindatailam, oils like Asana Eladi, etc. are applied over the leg and massaged in a specific pattern, which actually would relieve many symptoms. Along with that, special applications of oil in the head, something called as Shiro Abhyangam or Talakyanna in Malayalam. There was a special technique of applying different kinds of medicated oils over the scalp to control the symptoms all over the body, because ultimately Ayurveda does not cut the body into different pieces and into different systems. Ayurveda looks at the system as a whole, and any management is as a whole. So definitely in this background, in managing diabetic neuropathy, there are n number of possibilities that we can help the patient community to recover from the issue. So as a community, let us all make use of this great science for giving solace to many patients who are suffering from diabetic neuropathy. Thank you. Namaste.